about changing conditions. What is a changing conditions and what do you do with that information? All right, let's tie this into any and everything that we do. So what is a change in condition? A change in condition is anything that is abnormal for that patient. Okay, so it could be a patient with abnormal labs, a patient that spikes a fever, a patient that had a fall, a patient that had a fall with an injury, a patient that went out to the hospital, anything, okay, a patient that's up wandering, anything that results in something that is abnormal for that patient, okay? So then what do you do with that information, all right? Let's just talk about it, all right? Because sometimes we miss the follow-up in it, okay? So when you have a patient and they have a changing condition, of course, we wanna make sure we're doing assessment, okay? We wanna make sure that we're doing an assessment, and anytime you do an assessment, I always say, guys, get a set of vitals, all right? Get a set of vitals. Okay, look at the diagnoses, look at the meds. All right, so for example, you had a patient that had a change in condition secondary to a fall. Okay, so we're going to assess that patient. All right, we're going to do some set of vitals, we're going to look at the diagnoses, we're going to look at the meds. All right, we're going to paint a big picture here. All right.